So, the first time I heard that loneliness could kill someone was in a Britney Spears song. But guys, I must confess, there's some truth to this. There's research that shows that loneliness is as harmful to your health as, get this, smoking 15 cigarettes a day. Stick around, this is Real Life Psych. Welcome back. For those of you new to my channel, my name's Alexis Simos, licensed therapist as well as certified drug and alcohol abuse counselor. And this is my channel, Real Life Psych, where we discuss everyday mental burdens that have a significant impact on our mental and physical health, whether we realize it or not. New episodes will be coming out every Sunday for what I like to call Not So Scary Sundays. Think of this as the morning pep talk you needed to get out of bed to start your day. Today's episode is about the health effects of loneliness. Loneliness is a very natural feeling, so I hope this video doesn't bring you down so much. The intention is to spread awareness. So, the hard part about loneliness is that it's subjective. If you were in the apple beta pie sorority in college, then graduated, and now you're working at a desk job next to Pam and Phyllis, though you still may have some friends, you might feel lonely because you're not meeting your own standards of social interaction. You might even have a ton of friends but feel lonely because you're not in a relationship. Or you might have both but still feel lonely because you don't feel like you can be yourself next to the people around you. In today's society, our ability to stay connected has never been easier. Thanks to technology, even in a pandemic, we're able to keep up with one another, aka really silently stalk each other. But despite these advances, studies in the US shows that prevalence of loneliness is only growing. In fact, 1 in 5 people at any given time in their life will admit that they're lonely. And what's even scarier is that research shows that loneliness can have a negative impact on your health as well. A study in 2010 suggested that loneliness is correlated with the increased risk of physical decline and death. In fact, it can be correlated with death twice as much as obesity and comparable to that of smoking 15 cigarettes a day. Some reasonable theories are that lonely people have less people to keep them accountable for, to go to the doctor, take medication, eat healthy, or just get proper sleep. For example, we've heard stories of the parent who did everything they could for their health to still be around on the day of their child's wedding. Trusted relationships are subconsciously a big motivator for people to take care of themselves. In 2018, a study showed that 43% of adults over 60 considered themselves lonely. That's concerning, but makes some sense because at this age, many people have lost loved ones, gotten divorced, or just grew distant from the people around them. But guess what? Loneliness is not just in the elderly. In fact, it might be worse with millennials and Gen Z. That same study showed that 45% of millennials considered themselves lonely, and for Gen Z, it's up to 48%. But you would think that the generation that's most connected on all social media platforms would be the least lonely, right? But if we look closely, this study shows that 8th, 10th, and 12th graders reported more loneliness every year since the iPhone was released in 2007. Because having the ability to see your old college friends go on a vacation without you, or seeing someone's seemingly perfect picture relationship, depending on where you are in your own life, typically will do more to make you feel lonely than to alleviate it. And worst of all, it seems that loneliness can spread. Studies suggest that people connected to a lonely person are 52% more likely to be lonely, and only grow lonelier over time. But I can't stop this video without at least offering some words of advice to combat loneliness. Here are 5 tips to consider that could help you feel less lonely. Number 1, it's not about the amount of friends you have, but the quality. Consider forming communal relationships and less exchange relationships. In exchange relationships, you're seeking personal gain as a trade-off for friendship. It's like hanging out with someone because they have a boat you can take pics for your Instagram for. Sorry if that one hit home. Instead, focus on communal relationships, where people actually feel responsible for each other's well-being and expect a long-term relationship. These are typically the people you can stay connected with even if they move away. Number 2, social media doesn't have to be the enemy, depending on how you use it. There's the displacement hypothesis versus the stimulation hypothesis. The stimulation hypothesis suggests that online interactions can strengthen relationships for people who actively seek to reach out and connect with other people they otherwise could not connect with, like a Zoom game night when you're stuck in the home during a pandemic. In this hypothesis, reaching out on a social media platform may be beneficial. On the contrary is the displacement hypothesis. People use social media to replace real-life interactions. And sorry if I burst any bubbles, but social media is not real life. But if you find yourself as more of an observer than someone who's active, there's a decent chance that this increases your loneliness and maybe you need a break from social media. Number 3, try volunteering. The gift of giving is also very beneficial to the giver. Offering your friendship and your time to someone who is in need can actually be very rewarding to you. I know I practically said that loneliness could be contagious, but entering the relationship with positivity and with the intent to spread joy may also reflect some of that in your life. Positive feedback is a real thing. Number 4, consider adopting or fostering a pet. Research shows that interactions with pets can decrease loneliness, boost your mood, and increase feelings of social support. Some studies even suggest that pets' interactions lower your blood pressure. Number 5, and finally, guys, there's no shame in seeking some sort of professional help if you have the resources. Like I said, it could be life-saving. I know a lot of you are dealing with mental or physical health issues that isolate you or worsen feelings of loneliness. Or you might feel lonely without really knowing why. You may find therapy helps really narrow down the possible causes. It can be hard to deal with feelings of loneliness if you aren't sure what's happening. A professional can help you examine any situation in your life that may be creating these feelings. Like I say, self-improvement begins with self-awareness. And that's it for today's episode, guys. Loneliness is real, but we can work to combat it together. I don't know about you guys, but I think I'm going to be jamming to a Britney playlist for the rest of the day. I'm not a girl, not yet a woman. Gen Z's probably confused. Thanks for tuning in. Maybe today you'll actually follow through with the brunch plans you typically cancel out on. Make sure to leave a like, comment on your favorite part of the video, and subscribe. Catch you next week. See, Sundays don't have to be so scary.